Good afternoon, everyone. Welcome to the second webinar in the Substance Use Disorder series called Connecting Resources to a Community in Need. This webinar is being recorded. I'm Susan Halpin, your host. I'm the Education and Outreach Coordinator for the New England region of the National Network of Libraries of Medicine. Hey, your instructors today are Officer Patricia Joy Cummings from the Worcester, Massachusetts Police Department Crisis Intervention Team and the Worcester Police Addiction Recovery Program. And we also have Rebecca Zwicker, who is the Program Coordinator and Recovery Coach Supervisor for the Worcester Police Addiction Recovery Program. And the presentation slides and the recording will be emailed to you in a couple of days. The next few slides are just a little bit of background about the National Library of Medicine and the free resources that the National Library of Medicine offers. The resources are all online and available to everyone. We have resources for a wide variety of audiences, consumers, librarians, healthcare providers, public health workers, educators, researchers, students. We have medical and health information that's up to date, written by experts, and there's something for everyone. And the National Network of Libraries of Medicine is how we promote these free resources and our training programs and also some grant funding opportunities. Hey, if you find that this webinar is helpful to you, we have one more webinar in our series that's coming up on January 9th, and you can register for it at the link provided on this slide. It's about individualized treatment and understanding the non-pharmacologic components that are part of recovery, and it's actually to Dr. Gerardo Gonzalez and his public health quality control assistant, who will be talking about their experiences. They just opened up a new treatment facility called Washburn House here in central Massachusetts. And I just wanted to point you to this infographic. We have lots of resources about opioids, as well as mental health, all resources about all different subjects related to health and medicine. And if you click on the link provided, you'll be able to see some of those resources. So now I would like to turn the presentation over to Officer Cummings and Rebecca, and we'll get started.
Hi, I'm Officer Cummings, Worcester Police Department's Crisis Intervention Team and Program for Addiction Recovery. And here I'm with Rebecca Zwicker.
Hi everyone, my name is Rebecca Zwicker. I am the WPAR, Worcester Program for Addiction Recovery Program Coordinator, as well as the Recovery Coach Supervisor. So, moving on to the next slide, no one ever grows up thinking they will become addicted. You never know who this could affect. This is a high populated within our society right now. There are so many people who are affected by this disease, and could be your mother, brother, father, daughter, son. You never know who this can affect. So today we will be talking about connecting resources, and our objectives are recognize the signs of substance use disorder, also known as SUD or SUD, learn about strategies communities are using to reduce fatal overdoses while increasing community awareness and support for individuals and families living with substance use disorder. Learn about community resources available and what you can do to reduce the stigma associated with substance use disorder. An addiction is identified.
Oh, yes, addiction we have defined. Before we can go further into that, the phrase of drug addiction, the state of being enslaved to a habit or practice of something that is psychologically or physically habit-forming as narcotics, to such an extent that the cessation causes severe trauma. So we have people who use the drug in excess amounts prescribed. So basically, that's kind of common sense here, but basically you have a prescription, you use it twice a day for 15 days, and that's it. That should be all done after 15 days. But this person might use it for maybe 4 times and runs out way before the time allotted. And used for reasons other than prescribed. For example, we have an example like a birth control pill. Well, maybe you're using it for something that's unrelated. Or maybe, let me use a better example. You have a prescription for Clozaril, which is actually a an antipsychotic medication, and you're using it because you don't have a mental illness, but because you like the side effects of it because of the way it makes you feel. For example, Adderall. Adderall is a good medication that people use. It's usually used for ADHD, for those who have hyperactivity, and they use it because college students would use that for helping them think better. And so that's not prescribed to them. It's using it out of the context it's used for, and using that which is not prescribed is that third choice. And then the last one, all these may be displaying indicators of addiction. Now that we have that defined, addiction defined, let's go into more specifics. Drug addiction defined. As you see in number 1, it's a chronic, often relapsing brain disease that causes compulsive drug seeking and use, despite the consequences of the person of using and those around them. It is a brain disease because the use of drugs leads to changes in the structure and function of the brain, which in a few slides I will show you more about that. So let's go into the physical signs of opioid addiction. As you can see here, slowed breathing, marked sedation and or drowsiness, elation or euphoria, confusion, constricted pupils, very tiny little dots, off and on, nodding off and on, loss of constipation, loss of consciousness and constipation. Over by the where it says elation or euphoria, being on working as a Worcester police officer in the city, I do see some who have, they can be walking down the street or running or skipping, arms out in the air, and then we get a lot of calls saying there's a woman walking half naked down the street with, you know, arms up in the air blocking traffic, and she's not seeing what's going on around her, but you can see this is definitely one of the signs. And then the off and on, this is a classic one. If you're ever wondering what it looks like, the off and on nodding off, very groggy, very tired, just, you know, sometimes just, it's an obvious look when you see them because they're just nodding off and on, they can't keep awake, and then, of course, the confusion that goes with it. And so the next slide are other signs. This is something where if you have a friend, a roommate, a relative, and you're not familiar with what to look for, these are usually it. So doctor shopping, that's when you actually go down to, you get your prescription from one doctor, and then you go now to another doctor and get like 4 different doctors on a given day so that you can get a prescription, and each doctor gives you a prescription for maybe 30 to 90 days worth of, let's say, oxycodone. And but now we have what do you call the MP? I'm drawing a blank here. The pharmaceuticals now have a system in place where you cannot do that anymore. You go to the pharmacy, you go there, you get your first prescription, you get it. Then you go to another one. Before the pharmacist issues out another prescription, they look to see where you've had one before, or even if you're in the system. So now we're trying to prevent that. Shifting moods, social withdrawals, and new friends. Now for this, you're going to see people withdrawing from friends that they already knew. So for example, let's use a college student. College student is no longer associating with, maybe not even going to school. And now all of a sudden you have these new friends that seem to not, they don't work, they don't go to school, and that's a bad influence on the individual. And then sudden financial problems would be, for example, if your person was paying for their rent and now maybe they're behind, they're facing an eviction notice, they're facing maybe foreclosures, or maybe the college tuition and they're going to have to drop out. And the extra pill bottles. Having extra pill bottles will be, for example, maybe not even theirs. It could have somebody else's name on it, or maybe just the labels are ripped off. And then suddenly using mouthwash, breath sprays, or mints, wearing sunglasses. So sometimes the light can be effective on their vision, but at the same time, it covers their look, what they look like, and also the mouthwash and also it does mess with the teeth as well. Now this is, for the next slide, this is what I was referring to before, the brain disease. Now I'm not sure if you can see all the letters underneath the pictures, but over to the left you'll see the normal brain is for picture number 1, and you see how it's bright and all filled into the whole spot there. The second one is the chronic alcohol abuse, and you start seeing a little bit of that decay, holes, it's not as bright. And you go over to marijuana abuse. Now, a lot of people, the third one over to the right, the very end there, brain disease. Marijuana abuse, people are shocked to believe that they think it's okay to smoke. This is what your brain looks like after even using marijuana. Even though they're legalizing it, it's just anything that's misused. If you don't have a prescription for it, especially for young people, it does affect the brain. Methamphetamine abuse on the next one is also, there's some light there. No, it's the third, yeah, that picture on the bottom there, all the way to the left. That's the methamphetamine abuse, and then one next to that in the middle. Heroin use of 7 years. Look at all that decay, the deterioration. Now, the last one is what I really want you to look at. 6 weeks following detox. Only 6 weeks following detox, and then look how close, how it can, there's hope. This is what I always say, there's hope that your brain has a way of rebuilding itself. So there is hope. So Rebecca, we have common places to hide drugs. Can you tell us about that?
Sure. Hiding impersonal items in a highlighter, in the space between its nub and tip of a cap, inside pen barrels, lip gloss or lipstick containers, inside individually wrapped sanitary napkins, in sock drawers, inside a pair of socks, inside pairs of unused shoes, corners of shelves and closets that are not locked or cleaned often. Some of the most common places that you wouldn't think of is typically where it is. Hiding around the house, video game consoles, old controllers, remote controls, unused battery compartments, holes in mattresses, underneath box springs, stuffed animals, behind pictures and posters on the walls, inside a picture frame, in ceiling tiles, unfinished basement, in unused containers or areas down there, on a dresser, the soda can, water bottle, or thermos container that never moves inside of books, in the car, stashed under the hood, under floor mats, under seats of the dashboard, out in the yard, planters, outdoor ornaments, you know, on a person, you know, could be they hide it on themselves, you know, in their personal undergarments. You know, with women, they may keep it in their bra, go into the bathroom, be in there longer than a usual time, hearing scuffling around inside the bathroom. Maybe they hide it inside the bathroom, inside the medicine cabinet, inside of a pill bottle of old prescription from a year ago, something that has collected dust and no one goes in there. Just being able to hide it all around.
Also, too, where it says out in the yard, as an officer over there, we do have a shelter where certain things are not brought in. You're not allowed to bring certain, so they will hide outdoor planters and then go out when they have a break and try to see if they can go get a little bit of a hit, provided that nobody else has found their stash. And then as far as the coming in as a person who's arrested, we also have females that actually hide them in like needles and syringes, and they'll try to hide maybe crack or heroin, their bags in their bra, and they'll have like the crack pipes and whatnot, even in their personal, being held in the vaginal area as well.
Or men.
Yes.
Men will do the same.
Yeah.
They'll go to the extent of hiding it anally.
Yeah. All right, and the next one, tell us more about this one.
Common drug paraphernalia. Some of the most common things that you would see every day could be what it's used for. If you look at the picture on the top left, it looks like there's a cigar right there. So finding the insides of a cigar, it's known where individuals will cut open the cigar, empty it of the tobacco inside, and fill it with marijuana. They can crush a pill and put that in there as well. Cocaine, crack, doing the mixture of the two together. The card, you know, you'll see a playing card or maybe a business card, or even like one of the discount saving cards from like Shaw's, you know, the plastic cards, and use that to put the substance into a line and being able to see the residue on a dresser, or even in the bathroom over in the vanity area, seeing the residue on there. It doesn't always have to be a white substance. It can be, you know, light brown. Some of the pills of the opiates will have a coating on them, so you could find the coating of the pill, which would break the time release part of it. They actually sell like pill crushers. If you see one of those and maybe like a quarter of a straw with it, that's a big red flag. You'll also, they call it like a glass rose or a stem, which could be a pipe to smoke cocaine or pills or crack. Tin foil, they use I always call it wrong.
The copper Brillo,
like a copper Brillo pad, which they use that in the pipe to be able to smoke the substance. The orange caps to the syringes for IV use. Also pieces of cotton or pieces of a cigarette filter. Finding a cigarette that has the end cut off of it, like half of the filter, is a big red flag as well, because they use that cotton to be able to cook the heroin or cocaine, crack, whatever substance that they're using. Joy, do you want to add some more?
Oh, well, you did you mention big pens? They use that also? They turn that into
the big pens.
And you also reminded me of sometimes people use now the enteric-coating of the pills that are used to like slow the release. It's been known that people have used that. They swallow it and they wait for the digestive juices in their stomach to actually kind of eat at the outside, and then they regurgitate that and then they crush that. So there are ways around that, even though the pharmaceuticals, we're trying to see how we can prevent that. But when there's addiction that's really strong, people can be very creative. So tolerance. After a person uses, their system starts to adjust, resulting in the drug having a decreased effect. This causes individuals to use more to get that desired effect. So that's with everything, even coffee, for example. Someone drinks coffee on the first day, it's like, whoa, that woke me up. And then after a while, you need more coffee. Only difference is that when it comes to heroin, when a person stops, a lot of times it could be, when they stop, it could be because they're now incarcerated. They got arrested for something and now they're behind bars, and then 5 days, maybe they get out for court or they're released for the next court date. And then they go back to using what they did 5 days prior, but not realizing that their system has readjusted to some point. And this is where we always say that they're very high likely to overdose because of this, this tolerance. So potential signs of overdose. Constricted pupils that are non-reactive to light, periods of extreme sedation making them difficult to awake, lack of responsiveness even to painful stimuli, respiratory arrest, cyanotic, bluish appearance of lips and fingernails. So here when you have, as an officer working the crisis intervention team, I do also, and being part of the program for addiction recovery, one of my duties is to follow up on overdoses. And this is, we see this a lot. You approach them, they are already blue, sometimes purple. They do not respond. You do a sternal rub, you know, when you get your knuckle and you rub their chest to see if they'll wake up. Even, you know, a lot of people try slapping them on the face, which just a sternal rub is enough to know that the person can respond or not. And then the sedation, it's like even if you get one that's trying to wake up, you can look at them and say, that's really tough. If you're able to get one that's half awake, that's good because you don't want to approach one that's cyanotic. But if you do, and the person is, that's the next slide. What do you do? What do you do when one encounters one who may be overdosing? First thing you do before anything else is you call 911. The next one is you're going to do a CPR. And then the last step, of course, Narcan. The reason why you call 911 at first, it depends on how many people are present. Doing CPR alone can be very tiring. Knowing, and it's also stressful, you just found this person, either you know this person or you don't, that is passed out, unconscious, unresponsive, and may even be cyanotic, blue lips and not responding, and it can be frightening. So having 911, knowing that someone's in the background coming, kind of helps you also cope with your situation. And like I said, for the CPR, when it comes to CPR, the issue is not so much chest compressions. You want to do that, but the issue is mostly the mouth-to-mouth, the resuscitation, because the idea is to get oxygen to the brain. And then, of course, while you testing the, making sure that the person's, what they call the ABCs, airway, breathing, circulations, and if you're working on that, you want to administer the Narcan. What we administer as the Worcester Police is a 4 milligram dose. It's very simple to use. I'll show you that further down when we have talk more about the Narcan. And then after you administer the Narcan, you usually wait a minute to a minute and a half, maybe two, to let it work. You don't want to oversaturate the nostrils, the nasal passages. And then, but with the fentanyl, carfentanil, acrofentanil that's out now, we've been using more 3, sometimes 4 doses of that. All right, so in the next one, real life and getting the needed help while dealing with the stigma of disease. When you call the police, do you say overdose? What do you say? If you feel there's a bias in your community, what do we say? What is an option that we can say, Rebecca?
That I found someone unconscious.
Right. Because if you have a community that's not as proactive or more up to date about the issues of addiction, and there's a heavy stigma in the community, we always say, if you feel that's the case, and maybe that is the case, whether it's in your mind or not, and it's reality, then say it's a medical issue, there's someone who's unresponsive, and then when the police show up, you let them know what's going on. If you, when you have a community like the Worcester Police Department, we are very proactive, and we're actually up to date, very knowledgeable. When we hear overdose, Our idea is we need to get there right away because we can save that person. Every officer in the Worcester Police Department has their own Narcan, and we're required to carry it. As a matter of fact, even doing this webinar, I have mine on me as we speak.
And I have one too.
That's right. All right, withdrawal symptoms. You want to tell us about that?
Sure, withdrawal symptoms. So headache, diarrhea, nausea and vomiting, sweating, fatigue, anxiety, insomnia. These are more geared towards opiate withdrawal. A person will not die from opiate withdrawal, but they're going to feel like they are. The two substances that someone could die is alcohol withdrawal and benzo withdrawal. Those are the only two. Now, if they have a medical condition and are withdrawing from opiates, could there be a concern? Yes, of course, and that's where we have detoxifications, and the insurance will pay for someone to go inpatient to detox. When an individual is Narcan, they will, with the hopes that the Narcan works, when they come to, they are going to be very angry. It puts them in a immediate withdrawal, and they're going to feel all of these symptoms along with aggravation, agitated, angry, nervous, scared. Why are all these people standing around me? What happened to me? So their reaction is not always the pleasant reaction like, oh, thank you, you saved my life. You know, they went from having this great dopamine euphoria that they were feeling to feeling all of these negative feelings and scared on top of it.
So that reminds me, Rebecca, of a call that I went to, and we were responding to a male who had overdosed, and when I arrived, myself, police, fire, EMS, family members, were all in this little living room. And when the male came up, woke up from with the thankful use of Narcan, he was looking like, what the hell, what's going on? And after further conversation, I realized when I asked him, well, what do you remember? The last thing he remembered, and he lives on the 3rd floor of a triple-decker, was parking his car and getting ready to come upstairs and go into the house from the front door. He wakes up and he sees all of us hanging over him. So he's lost a chunk of time there. That's a lot for him. And he's shocked now. He has his girlfriend there. And it's like, who are all these people? Why are they here? So when we approach them, we also have to realize as officers that he needs to give him that time. We don't have overstimulation when everybody's talking at him all at once. Even one person talking it will be kind of, you'll see the anxiety, and then you'll see him pacing back and forth. And then also to the diarrhea part, they want to go to the bathroom right away. So you will see that. And before I go to the next slide, I just wanted to ask, you mentioned benzos, Rebecca. Can you tell us what that means for those of us who don't?
Sure. It's a prescribed medication, and usually it is prescribed for a general anxiety disorder by a psychiatrist. Sometimes the primary care doctor will give it for a short term, or some individuals can be on it for a very long period of time. And the withdrawal from the benzos is typically given like a Librium or a taper to come off of the benzos.
So you mean benzo?
Diazepam.
Oh, okay, yeah.
Benzodiazepam.
Okay, that's what I'm getting at. Okay, so the next, so we all know, because after a while we do have the lingo, we use the acronyms.
Yes.
And we have to remember that not everybody understands that.
Yes. So the WPAR, the Worcester Program for Addiction Recovery, we have a volunteer training program, and the way that it's set up, it's an 8-week training, and over on the right-hand side, you can see all the different training topics that we go over. This is a community event that we do. So we had multiple applicants who applied for this, and, you know, they had to meet certain criteria. You know, last year, 2016, they said that 76% of the United States is affected by this disease in one way or another. Either they know someone, they have a loved one, a friend of theirs, someone that they went to school with, someone that they work with is affected by this disease. So we had a very strict criteria for individuals to be part of our volunteer training, and, you know, the individuals had a motive to be there. And either they personally had a loved one maybe pass away, or them themselves have been in recovery now and have been able to walk through it. So we had one-on-one interviews, 3 of us who are part of the advisory board, and then also with the person, the applicant. And out of all of our applicants, we were able to have 8 successfully be trained and are up and ready. So the trainings that we put them through is the community perspective. We had the law enforcement, we had the district attorney, Joe Early there, chief of police, Steve Sargent. We had the recovery drug court judge, Judge Allard Madaus. And do we have any city council? You know, it was a large group of the city leaders, because we need to combat this as a community coming together. Like, it can't just be the police department trying to do it, or individuals or volunteers in the community. We need everybody as a whole to be able to start to get down on this. So our training objectives: reduce fatal overdoses in the community while increasing awareness and support to individuals and their families. Breaking the barriers between the community and police officers, and reducing stigma within our community by providing helpful information and resources to enhance their capacity. So a few of the trainings that I'm going to touch upon, and then Joy will follow up after me. Stigma and labels. So the language that we use within the community is what is going to help break that stigma. And if I happen to interact with someone who does not use accepted language, or the society language that we're leaning towards now, I will, in a useful way, let them be aware of it. Because one of the ways to change a behavior is to let someone be aware. And a lot of it is just lack of education or lack of not knowing, and just need to be made aware. I'm a person in long-term recovery, and I personally had an interaction with a nurse, and her statement to me was, "Oh, so you've been clean," and, you know, she went on to say whatever my record was saying, and I had to stop her and say, "Hey, you know, just to let you know, I was never dirty. So by telling me that I'm clean, you're automatically labeling me as dirty." Same with, if you notice, I say I'm a person in long-term recovery. When you hear the word addict, behind that one word is some negative labels. Prostitute, homeless, junkie, dirty, smelly, poor. You know, this disease affects everybody. So I'm big on positivity. So I like to embrace the positive and, you know, use that word recovery. Behind the word recovery is powerful, strong, loving, caring, mother, daughter, father, son. You know, so I try to be big on the language and spreading that in the community. I'll touch on what is recovery and principles of recovery, and about it, the strength-based. So the recovery principles, the first one is self-direction, and an individual determines their own path to recovery. So this is an important piece of the recovery coach and the strength-based. Who am I to work with an individual and tell them this is what you have to do in order to remain in recovery? They are their best teacher, and it's about offering what knowledge you can to them, and it's their path of what they choose. And individual and person-centered, there are multiple pathways to recovery based on individuals' uniques and strengths, needs, preferences, experiences, and cultural backgrounds. The empowerment is another recovery principle. Individuals can choose among options and participate in all decisions that affect them. The holistic recovery focuses on people's entire lives, including the mind, body, spirit, and community, all coming together. Nonlinear recovery isn't a step-by-step process, but based on one continual growth, occasional setbacks, and learning from that experience. So being able to see and recognize, okay, well, you did great for 3 months, and you had that one time that you made that choice, but look, you did great for 3 months. Let's focus on that. Dust your shoulder off, pick yourself back up, and let's move forward. The strength-based recovery builds on people's strengths, seeing the positivity, seeing the good. I'm proud of you, being a cheerleader. The peer support, mutual support plays an invaluable role in recovery. Respect, acceptance, and appreciation by our communities, system of care, and the individuals are crucial to their own recovery. And the responsibility, individuals are responsible for their own self-care and journeys of recovery. So I can give options to individuals, but it's their own responsibility of what they do with that. And then hope, a recovery's motivating message is a better future that people can do and overcome any obstacles. And then the last one that I'm going to talk about is the stages of change. So within the stages of change, there is pre-contemplation, and this is, people in this stage may be aware that there are repercussions related to their addiction, but they may minimize or justify their choices, seeing more benefit than deficit, not a great deal of desire to change any of those behaviors. And then stage number 2 is contemplation. Individuals in the contemplation stage have become aware of the greater impact of their addictive behaviors, yet they are uncertain if it is worth the effort to affect change in their lives. They may be open to considering change someday. They'll say, someday I may have a problem, but not today. And then stage number 3, preparation. At this stage, people begin to see that they are responsible for their choices and have the power to make life-changing decisions. They need to do it for themselves, but need not to do it by themselves. They set an intention to gather the resources, whether if it is in the form of a therapeutic intervention, a 12-step meeting, or other recovery supports. They are set in a timeline and make a verbal or written commitment to do that. And then action, stage number 4. In stage 4, people take the actual steps to engage in positive mental, emotional, and physical change by immersing themselves in addiction recovery, not just by being abstinent from whatever their choice was of substance. Could be a life makeover. That could include developing a fitness plan, dietary, as well as changing their friends or positive people who they want to engage with now, positive activities, and just changing. And then stage number 5, maintenance. People that are in maintenance stage have become able to sustain these patterns like to do a fitness routine and continue to do that fitness routine. On the first day of workout at the gym, you're not as strong, and then they continue to work out at the gym and they become stronger and stronger, more energetic, and next thing you know, it's a year later. And the more practice they do, the easier it gets for them. And then Joy, did you want to talk about any of our trainings?
Yeah, so one of the things that I would like to, well, let me start with the law enforcement response. For the city of Worcester, the crisis intervention team is, they'll definitely starts off with the mental health aspect. We deal with people in crisis, and in addition to mental health, it's the overdoses that we follow up on, respond to, and then we also have homelessness. We try to see, a lot of times this is the reason why people are in the predicaments that they are regarding drugs or substance use is because of homelessness, and sometimes it's a revolving door, it's a catch-22 there. And of course we do the re-entry process. The re-entry program that we work with the Sheriff's Department, and they have a person from their department that works with us, and we reach out to those individuals who have gotten out of jail, have been incarcerated. When they have a substance use disorder, before they get out, a lot of them are given the shot of Vivitrol. Our job, and the Vivitrol shot is good for 28 days, so we like to try to reach out for them before to make sure that they actually set up an appointment, actually actually went to a primary care physician, a PCP, to actually get the next dose. And that's kind of like where we follow up to make sure that if there's any gaps and holes, that they were having problems and they were not successful. And we try to figure out how we can bridge that and try to help them get their issues resolved. So one thing a lot of people look at is police and citizens, and they're like, well, I'm not sure about that. But we have what we call a JDP, a jail diversion program. And one of the things is if we try not to arrest, if we can get you help instead, if there's some kind of, let's say there's a chargeable offense, we can actually put that either on the back burner, summon you to court, and that could bring us to the recovery court. We have what we call the drug court, which is recovery court. This here, people can observe. It's open well, it's only on Thursdays, and it's open to the public, to all. It's not, you don't have to have an appointment. Every Thursdays at 2 p.m. at the Worcester Police Department's court, Worcester District Court, we have a drug court in session. And this, you can look, observe, and in here you'll see people who have been charged with an offense, and part of the conditions of their charges is that they try to seek some help with their substance use. And let me see, and let me just go up to, so that basically that's what we do, and then let's go over to, let's see, active listening. One of the things that was very interesting in this one is sometimes we need to listen. Maybe sometimes a person needs to vent. And sometimes the person, what they say is more important. And at the same time, sometimes what they don't say tells you volumes. This active listening, we can tie it up with motivational interviewing. So with active listening, you're going to be looking at what they're saying. You're going to be looking at body language. You're going to be looking at, let's say the person is not looking at you. When you hit a certain topic, they might shy away. They might change the subject. This is what the volunteer advocates were learning. And so we had used some examples. Person who maybe has arms folded, shows like defiance. And then all of a sudden maybe you say something that makes them interested, and maybe they'll start leaning forward. So you'll see the body language, okay, I got them. We have what we call hooks and triggers. The hooks is when you get somebody to kind of like, now they're listening to you, and and it looks like they really want help, and you're saying something that really hits home for them. The triggers are what shuts a person down, they get upset, and the last thing is no one can concentrate and you can't communicate when it's one-sided and the other party is not listening. So that's why you want, as you're having the conversation, you want to pick on what those triggers are so you can avoid them. But at the same time, remember them, because that might be the reason why they're having their issues. So everything is all about listening and absorbing all the silent signals. And then we did the Narcan training, which we'll show you a couple of slides from now. We showed how it's the Narcan is used, when you use it, and when you're using it, putting them in a recovery position, which is on their left side. All right, and then you also have one thing that's very interesting and very important for our class was the boundaries and ethics. When you are in charge, let's say you're a volunteer advocate and you are now assisting someone. Question is, can you be their friend? You can be kind, courteous, respectful, but a friend has a reciprocal relationship. It goes back and forth. Whereas a person who is a recovery advocate, what we call our volunteer advocates, is there for one purpose, to make sure that you have all the support you need for your recovery. So it would not be fair to say that they're friends. We even have the example of a person who, what happens, is this ethical to actually take the person on a fishing trip? So we pondered over that, we discussed it, and one of the things was like, well, what's wrong with that? Well, the question is, how many as a volunteer advocate, how many people or clients do you work with? And of the people that you're assisting and trying to help, let's say you start with 5. And of the 5, do you take all of them to a fishing trip? If you don't, that's questionable right there. Let's say one doesn't want to go to a fishing trip and say, well, you took him to a fishing trip, why can't you take me shopping? So that opens up another situation, and people in the recovery community can be very manipulative, and you also have to understand why. When they were using let's say heroin, crack, cocaine, whatever their drug of choice was, they were in survival mode. Their body has adjusted to this. Maybe at one time, for some, it might have been for a high, and now later on it became a necessity where I don't feel well. I need this to function, even to go to work. And some people do work. So knowing that, things do change. So you've got to also know that in addition to the habits, it may not also be because they wanted to get high for a good feeling because people introduced it to them, but it could also be because they had a car accident. Maybe they were driving their vehicle for work, had a car accident, now their pharmacist prescribed them a drug that now they're become addicted, because during the time when the drug pharmacies were issuing, these were like 90-day supplies, they did not realize, which is a good percentage of the reason why we are in the opioid crisis that we have now. But in spite of all that, you have people who they're going to be manipulative. It's a life survival that they need this, and it works. And are you going to quit something that worked for you before to get your way? So that's why you need to understand as a volunteer advocate when they're trying to manipulate you and why and what you do, and that's what we were teaching. And of course, the most important thing, the Samaritan law. As long as you're doing it all in good intent, you are covered. You will not be sued. And we had the last part there, Community Resources and Network, and we had AG here, CHL, Spectrum. Because for our advocates to be able to help people, they have to know how the agencies interact and operate. So the next slide is Narcan, or we'll call naloxone. This app I did download myself, and if you can see that little picture in is the one that we use. That's the 4 milligram dose of Narcan. It's simpler to use than what we used to have before, which was a 2 milligram dose, and it had a little glass tube. It was like a syringe. You had to disconnect all the parts, and you had to make sure that all the parts went in the right place, and you had to make sure if you didn't get it right, you couldn't use it. So imagine being under stress. You've never used Narcan before. You always had it in your pocket or in your purse or wherever, and then all of a sudden you're getting ready to use it, and you're fumbling over, and it's a glass tube, and you drop it. Well, the answer to that is this now. What we have, I'm not sure if you can see that, but right on that cell phone is a picture right in the middle there in the circle is a Narcan. And it's easy to use. It's nasal Narcan. It's like a nasal spray. You can just inject it. So over to the left, you see the facts about Narcan. It doesn't work if the person's taking other drugs. So a lot of people say, well, how do I know what the person took? I mean, what is it going to harm them? Well, if you inject it, if you insert it through the nose and you spray it through the nostril, 1 dose. If it doesn't work, that means they were not under an opioid. If it works, it's because they had an opioid use. And then it says where to get it. In the city of Worcester, we have, you can go to any pharmacy. If you have insurance, and sometimes there's usually a copay with that, I always suggest to people that you can go here to the AIDS Project Worcester, we call APW, on Green Street. That's 85 Green Street, over onto the side of the building. You enter through the Plymouth Street side, and you can get free Narcan. They'll give you a little pack of 2. They also sell bleach kits. And if, let's say, you're not sure, like, why do I want to use this? Aren't I enabling the individual to continue their use? Well, even if you thought that, just imagine, by giving this person this, they have a second chance and making a better decision in their lives and actually getting help. So there is a free app. That's the app there on the side there to the right. And yes, it's free. I downloaded it myself. It does give you some step-by-step guides and whatnot and where to get it. So even if you're not from the city of Worcester or the state of Massachusetts, it'll provide you some info. Then legal concerns we had discussed, if I administer and something goes wrong. It's the same thing as when people used to do CPR. When they're pumping on the chest and they break ribs, you're not going to be charged for that because you're intent. Now, if you're trying to beat the person up and you want to sabotage them and kill them, well, then that's going to come out, and but this is not for that. That's a different situation. And one thing, you cannot administer Narcan to yourself. When you're under the condition where you need Narcan, you're usually out cold, and that's why it helps when you have a family member or someone nearby who can actually participate and help. And if it's in your home, I emphasize this. I tell most people that I encounter, tell a family member where it is. Is it outside? Outside the backpack. Let's say, for example, if there's a pocket. You put it, well, I'll give an example. I encountered a male who claimed that he was with his fiance, and she said that she saved his life numerous times. And he says, well, yeah, I have Narcan. I was like, well, where is it? And it's like, yeah, right here in this bag. So while he's telling me where it is, he's fumbling through it. It's taking a couple of minutes there. And then I take out the Narcan that I keep on me, and I gave her one. I said, here, if you ever need it, you have one. So now if you haven't needed, you can use it on him. Then he finally finds his Narcan, and I said, that was a long time. You took a while to get that. Now imagine somebody else that would never find it. You had an idea that was in there. So what if we put that in the outside, that all you have to do is reach the outside pocket, and then tell people where it is, so if you ever need it, and save lives. So what does the data show? So in the month of June, we had 66 overdoses, and we had 3 deaths. So how many times was Narcan used? At least 63 times. What does that show? It shows that Narcan worked. So even if you were on the fence about, well, I don't know about whether we should have that. Matter of fact, the most recent was yesterday. Actually, the most recent in the news, Fox 25, was having Narcan boxes so that anybody needed Narcan, they have access to it. And a lot of people were like, why would we do that? Well, just imagine, those could have been 66 deaths, and that's just 1 month. August, we had 105 overdoses. That could have been another 105 deaths. So even if you're like on the fence, just saving lives for now, and then all these people, not all of them, but some of these people also went and got help and are going to recovery court and are seeking help, and they had a second chance or a third chance or a fourth chance. But that wouldn't have been so without Narcan. So whatever your viewpoints on Narcan, just remember that.
I kind of already talked about this, but here's a list that you can just refer to about the language and how important it is on the stigma and how to support your community by removing that barrier and stigma.
I like what you were saying when we had this class, we were teaching, and we had a chart one chart had addiction, and the other chart had recovery. And before we even went to the recovery, we just said, when you say addiction, what do you think? And you should have seen the description that everybody was saying, like Rebecca, you had mentioned, a prostitute, dirty, like useless, no help, doesn't want any help. They're like, you know, dredges of society. Then you go over to the other side, and it was recovery. And recovery was almost like hope, all the positive words. Mm-hmm. And it's like, when you look at that, I remember that. And I was looking at the students as they're like, yeah, and like, this is the thing that people need to see, because they're not seeing this. If they knew that every person has a backdrop, a story, and we don't know what their story is or where they are at that moment. Mm-hmm. All we need to do is, we can stop that stigma. For example, calling people addicts. Even people themselves are calling themselves addicts. So how do we stop that? If we just remember the wording. If we ourselves don't use the language. I'm not saying going out there and be preachy and say, oh, don't use that word, that's wrong. I know we were thinking that in our heads, but at the same time, it's like acknowledging that when you hear it, wow, and then using the other words, then people start to pick up on your words as well. Mm-hmm. Well, this is like I said, you don't know everyone's story. Okay, we have doctors, family members, community leaders. Even some doctors are not even on the same page with us when it comes to language. And we do have community events. We had a rally, a recovery rally. We had motorcycles that come in. You know, that raised a lot of money for Learn to Cope. And then the politicians supporting these events. I was told at one point when they saw the politicians, they said like, oh, they shouldn't be here. That's not for them. It's for us. And I said, wait a minute. This is not a him, them, or us. We need politicians. Mm-hmm. Politicians have a lot of power. They're the ones that can make a program of be placing up, for example, the Narcan boxes that we're talking about. That's going to take federal money, taxpayer dollars. If they're able to support it and suggest it, and people are like, oh, okay, I get it, then if it wasn't for that politician, we wouldn't have it. So there is a give and take here. And besides, it's not what's going on with the recovery community with drug addiction is not an us or them. It's affecting all of us in one way or another, whether you know somebody, whether you run across it, family members, it's affecting everyone. Mm-hmm. So it's all of us. So why is the opioid addiction problem is complicated to fix. The top one there, people do discuss. Now that the problem has reached the suburbs, there is attention. Oh, this is a new epidemic. It's not new. Heroin has been around for years. As a matter of fact, if anyone's familiar with the city of Worcester, back in 1990, we had big billboards that were saying that this area has a high risk of AIDS. Well, a lot of people are using it through the IV drug use. So it's not that it's new. It is true that there is attention now because now it's the suburbs and the white population has it, but we need to look at it as, okay, and now because of that, we're now facing some issues that we now can actually help somebody now. Regardless of how we got here, we now have attention to it. And now, big problem is the insurance company. Coverage for treatment is lacking. If you don't have this insurance, sorry, we can't help you at this agency. This agency is supposed to be for substance use or alcohol abuse, and we can't go there because I don't have that insurance. So then we also have pharmaceuticals. They're still over-prescribing. For example, a 90-day supply may have dropped down to 30, but it's like a friend of mine was saying that they just had their, going to the dentist and they're going to have their wisdom teeth pulled. And it's like, okay, so what the opioids, how many do you need? You're asking an individual, a patient, how many pills they need, and this opioid is how many years into it, this crisis? And then due to the negative stigma, those in need of recovery do not want to come forward, so they stay hidden. If I'm being called an addict and a low life, I may not be forthcoming myself. And then crimes committed to fund drug use result in a query that can affect housing and job prospects. So you can be an individual that, was going to school, was working, had a, regular, what we call normal lives, and then all of a sudden you get into this habit, you get arrested, and because of the arrest, go to court, now you have a CORI. And for those who don't know, CORI is a criminal offender record information, where that follows you everywhere. It's gotten to the point where now if you go apply for housing, you got to file this form, fill it out, and have you ever been arrested of? And now you're faced with a CORI. Now I can't move in this house. Maybe I can't move in that housing development. And then what? Now what's even worse is the job prospects. Well, if I didn't have the drug problem, the substance use that I had, then I'd have this job, but because of that I can't. So now it's different. And now your skills, regardless of what your skills and what you're eligible and you're qualified for, you are now going back to like as if you never had those qualifications at all, starting from scratch. Mental health services are also lacking, and we're not treating the underlying causes of mental illness. A lot of times it could be a dual diagnosis. A lot of people use it to self-medicate, whereas the last one may suffer from a dual diagnosis, may self-medicate, thereby result in addiction, which can be a revolving door as well. All right, stories of hope from the front lines. This is a story. I know a man who's overdosed 5 times this year, and I'm going to be reading it. He is homeless. On the 6th time, as I told you before, I do follow up on overdoses for people who have overdosed. I approach him and I try to see if I can get him some help. He said he had no intention of stopping. I tell him that I'm here regardless of what decision he makes, and I try to find out a little more as to why. But either I said, okay, that's fine. And then that's when I leave him his Narcan. And this is the same gentleman I was telling you about that's fumbling through his bag looking for this Narcan. And he finds it, and I tell him what he should do with it, and so the fiance, so that everybody is, on track. Because she's brought him back to life on the 7th time. So she used the Narcan. Then he still does not want any on that 7th time, but on the 8th time, I asked him again. This time he said, yes, it's time. It took 2 hours for me to finally get him to a detox bed, but I told him I was not going to leave until I found one. He was getting to the point, no, you don't have to waste your time, that's okay, I'm all right. I said, no, this is important. I'm going to do this for you. I've been telling you, I'm going to keep an eye on you, and I'm going to do this for you. And he actually went and got his, got the detox bed.
Yeah, so I'll just share a little bit. At the age of 24, I was married. I owned a house, had 2 beautiful children, and, I was living the American dream. We had the dog and the dog house in the backyard with the house with the white picket fence, so America calls it the American dream. And I ended up getting into a car accident on 290, and I got prescribed my first opiate, which became a heroin addiction. And going in and out of treatment, criminal justice system, in and out of jail, in and out of detoxifications. Over time it went from the pills over to the heroin and to becoming homeless. And I ended up having a non-fatal overdose. And I woke up in ICU hospital a few days later, and the doctor had came over and talked to me and said, oh, you're probably in some pain. You have 8 broken ribs from the CPR. And don't think I'm going to give you any pain meds for that either. But you're medically cleared, so we're going to discharge you. And I wanted help so bad at that moment, but I was so ashamed and the stigma that came behind it that I didn't know how to come forward and say, hey, I'm homeless and I'm sick right now from my withdrawals, and if I leave, I'm going to leave and go and use. And unfortunately, but fortunately, because I'm in recovery today, I left and I end up using again, and within a day or 2 later, I end up going through the criminal system, similar to like a diversion program where the judge really helped me out and saved my life. and I've been in recovery ever since. And, you know, I'm able to have that empathy and compassion for individuals who are struggling. And I don't like to say that I've been there, I know how you're feeling, because everyone is different. Everyone has their own feelings behind it. But I do remember what it was like it was yesterday, to be sitting there and that feeling and having like the doctor like looking down at me, and I've been here in ICU, I'm in the same clothes for a few days, and you know, just that look like I'm not giving you any pain meds. So being able to have that voice and you know, advocate for individuals who are seeking treatment with a compassion and loving manner towards them, and the respect that they deserve, because you know, that it's a big step for someone to seek treatment. It's scary for an individual. It's unknown to them of what they're walking into, whether if they were in recovery prior to that or not. It's a big step for someone to make that decision of not using anymore.
All right. You know, I just wanted to, the next few slides are just some resources that you may find helpful. We won't spend a lot of time on them. We're recording this webinar from the University of Massachusetts Medical School, and that's where the New England region of the National Network of Libraries of Medicine is housed. And Massachusetts and UMass Medical School has been a leader in providing education for healthcare providers about how this is a disease. And many of the things that Rebecca was saying are part of the treatment that our medical students are getting now. There's a whole course about addiction, and they happen to showcase some of the things that are going on here at UMass in this documentary called Matter of Fact, State of Addiction. So if you have interest in learning about it, you can click on the link. Your state may have some collaborative and innovative programs too. This is a program from North Carolina. So I think it's important that if you want to learn more about what's going on in your community, these are some of the places that you can go. I don't know if either of you have any thoughts.
Sure. We have a lot. Like I was saying earlier, it's a community coming together is how we're going to be able to combat this. And, you know, we need to be able to have contact and be able to tell an individual, like, oh, yeah, I checked out Washburn Detox, and this is what it looks like. This is, you know, how their day-to-day activity is, you know, and just having resources available. So if that person doesn't want treatment at that moment, or if you're talking with a family member who is dealing with an individual in early recovery or experiencing non-fatal overdoses or, unfortunately, fatal overdose, we have Learn to Cope. They are all over the United States. I would highly recommend it. They have community events within our community and different types of support groups open for family members, mostly a parent or grandparent who's going through a family member in withdrawal or the opioid epidemic.
The local health departments, too. We have DPH, Department of Public Health. They're very, and in the city of Worcester at least, they're very involved, and they do a lot of funding for a lot of programs here, too.
Yes. Yep. They do recognize that the quality of life is not there where it needs to be right now. And since I shared that little personal story with all of you about my experience, the recovery drug courts, it's a very positive, uplifting, it's empowering to sit in there and watch one of the sessions. So the judge who detained me and yelled at me and told me I needed, you know, treatment and that he was going to detain me until they found me a bed in the program is actually the judge who started to do the recovery court. And he was, like, for the first year of my recovery, he was my biggest cheerleader. And after I received my year, he told me the first year was for you, now I need you for me. So, you know, it's a very uplifting environment to be able to experience.
All right, so what if you saw this pill on your nightstand, of the nightstand of your friend or family member? What would you think? If you know what it is, let's say over to the left, you see it says Adderall, XR, 25 milligrams, and over to the right, it has an N and an 8. So one, you see Adderall. The next one, you have no names, just symbols. Let's look at the next page. Okay. So here's an awesome website. I love it. If you click on, so this is called Pillbox. Over there, you'll see a section there. It'll have, let's see, the second, it'll have the imprint. So let's look at the, I had two pictures. The one with the 6 shapes, it was orange, had an N. The picture to the right. Let's say we're going to use that. We're going to use that information first to fill in the next slide. Go into imprint, any numbers or letters, you put an N and an 8. Then you go down to the next one, it says shape. As you click on the drop-down box, we can't do it here, but if you click on the website down below, you can click on that link, it'll get you there. The drop-down box will select the shape, 5 sides, 6 sides, and this 8 sides. So in this case, it's going to be the 6 sides. And then color, we're going to use orange. And that's it. When you click on that, that pill will pop up and it'll tell you what it is. And that's actually Suboxone. And that's, people use that as a, so if you use a drug, you will not feel the effects of it. It's very effective when people use it regularly. And so let me go over to the next one. The other one was Adderall. The photograph that we had, it said Adderall. Let's say you don't know what it is for. It'll click and tell you what the medication is used for, like Adderall is used for concentration, like those who have ADHD. And if you have like you're a college student or a roommate or a daughter or a son who's in you'll see those pills and, wait a minute, you don't have a prescription for this. So you're using this pill that requires a prescription to be used. Then you look at the other side, the first one we talked about, Suboxone. And if you see that, you're like, wait a minute, what's going on here? Why do we have this? Then there's usually some kind of substance use disorder going on there. So it's awesome to play around with it. I suggest if you have any medications in your own cabinet, pretend you don't know what it is and just to see how the app works.
And this Pillbox tool is actually one of the National Library of Medicine resources. And on the next slide, I just wanted to show you some of the other places that you can get information that you can trust. All of the information from the National Library of Medicine has been written by experts. It's free. It has no advertising. The information is current. It's been peer-reviewed. It's a really good place to start. So on the left-hand side, this is our drug information portal, and there are many links to drug information and information from other U.S. government agencies that will provide you. There's training courses in this portal. There's information about treatment, information about addiction, resources for children, for adolescents. So anyway, on the right-hand side is Medline Plus, and again, this is one of our great websites. This happens to be the opioid addiction page, and there are many links out to other parts of the addiction topic that you may want to know about. So if you're feeling like you want a good place to start, Medline Plus would be a great place to start to learn what you would like to know about addiction. This is a picture of a current app. It's actually specific to Massachusetts, but it's called Marcy Road, and I actually just downloaded this app on my phone today. It is pretty new, but what is great about it is the purpose is to have an up-to-date list of available beds in treatment facilities. When people are going through addiction, oftentimes things change quickly, and if you are at a point where a person is willing to get help, you want to be able to have up-to-date information quickly. So this is a new app. It's for Macs and Androids, and it's free. These are just some, I'm not going to spend much time here, just again, other places you can go that are reputable places to find out about addiction. Officer Cummings, I know you have familiarity with Harvard University.
Yes, I just started this one. This one was a class that was offered, and it's an online course for opioid addiction. And you can get a knowledge about it. A couple of things that you can go on there. You see actual panels from different, you'll have like a police officer, a person from the City Hall, and you have all different agencies in a panel asking and answering questions in different towns. You'll also, if you decide that you want a certificate, they would, it's like $99 for you to have an actual certificate. But it's very knowledgeable. It's another way of learning more about the opioid crisis that's going on.
This webinar actually is a re-recording of the webinar that happened on September 27th. And we had some difficulties technically with that webinar, and it did not record. So Officer Cummings and Rebecca were kind enough to come back and re-record this webinar for all of you. So right now we don't have any questions, but I want to thank them so much for doing this 2 times now. And I also want to thank those of you who attended the webinar the first time for attending. So the next slide will just give you the link to the evaluation. If you are getting CE credit from MLA for this webinar, you'll need to click on the survey link and give your evaluation, all right? And then the last slide is just how to go about getting your credit certificate. So I think that's all for today, and thank you very much. All right. Goodbye.